The FDA label for this pill carries a boxed warning, the most serious warning the FDA can issue. It says abrupt discontinuation after continued use may precipitate withdrawal reactions that can be life-threatening. Millions of people take it every day. Most have no idea stopping it suddenly could land them in an emergency room. There is a pill that does something almost no other medication can do. Within minutes of taking it, the anxiety stops. The chest loosens, the racing thoughts slow, the body unclenches. For someone in the middle of a panic attack, that relief feels like being pulled out of water. It is real, it is powerful, and it works. That pill is alprazolam, sold under the brand name Xanax. It belongs to a class of drugs called benzodiazepines, and it is one of the most prescribed psychiatric medications in the United States. Tens of millions of prescriptions written every year, prescribed for anxiety, for panic disorder, for the kind of fear that makes ordinary life feel impossible. And for many people, it provides genuine relief when nothing else has worked. But the FDA label for Xanax contains language that most patients are never shown at the pharmacy counter. Language about what happens when the pill is taken for longer than it was designed to be taken. Language about what happens when the body adapts to it. And language about what happens when someone tries to stop. To understand why Xanax is different from most anxiety treatments, you need to understand what it does inside the brain. The brain has a chemical system designed to slow things down, to quiet excessive activity, to reduce overreaction, to create calm when the nervous system is running too hot. The key chemical in that system is called GABA. Think of GABA as the brain's natural brake pedal. When anxiety spikes, when the brain is firing too fast, too loud, too intensely, GABA hits the brakes. It reduces the noise. It slows the signals. It brings the system back to a manageable level. Xanax works by making those brakes dramatically more powerful than they would ever be on their own. It binds to the same receptors that GABA uses and amplifies the calming signal, immediately and intensely. The result is fast, reliable, powerful relief that most people describe as unlike anything they have ever felt before. But the brain does not passively accept this change. The brain is always watching, always adjusting, always trying to return to what it considers normal. And when it notices that the brakes are being applied far harder than they should be, it compensates. It begins producing less of its own natural GABA. It reduces the sensitivity of its own calming receptors. It pulls back its own brake system because the external source is already doing more than enough. This is tolerance. And it begins developing much faster with Xanax than most people are ever told when the prescription is first written. The FDA label for Xanax states this clearly. Even after relatively short-term use at recommended doses, there is some risk of dependence. The label identifies treatments longer than 12 weeks as carrying significantly increased risk. But here is what makes Xanax different from other medications where dependence is a concern. The label carries a boxed warning, the most serious level of warning the FDA places on any drug. It states that abrupt discontinuation or rapid dosage reduction after continued use may precipitate acute withdrawal reactions. And then it says something that stops most people when they read it for the first time. Those withdrawal reactions can be life-threatening, not uncomfortable, not difficult, life-threatening. The most serious withdrawal symptom listed in the label is seizure. A person who has taken Xanax every day for months or years and stops suddenly is at risk of experiencing a seizure, not because they did anything wrong, but because the brain adapted so completely to the presence of the drug that its absence creates a crisis. If someone you love takes this medication every single day and has never been told what stopping suddenly could do, stay with this. So what does long-term Xanax use actually look like inside the body and mind? The first thing most people notice before they ever think about stopping is that the pill stops working as well as it used to. The dose that once produced 2 hours of calm now produces 45 minutes. The relief that used to feel complete now feels partial. Some people increase their dose. The doctor agrees. The anxiety is real and the original dose is no longer enough. The new dose works for a while, and then the same thing happens again. This is the brain's adaptation working steadily against the person taking the medication. Because the brain has reduced its own natural calming activity, the person now needs the pill not just to feel calm. They need it to feel normal. The absence of the pill no longer means returning to baseline. It means falling below baseline into a state of heightened anxiety, restlessness, and agitation that the brain itself is now generating. This is called rebound anxiety. It is one of the primary reasons so many people who try to stop Xanax find it extraordinarily difficult. Not because of a lack of willpower or strength, but because the brain has reorganized itself around the presence of the drug, and the anxiety that returns when the pill is missing is not the original anxiety the medication was meant to treat. It is the brain's own suppressed calming system, held down for months or years, suddenly released all at once. The label also warns about cognitive effects of long-term use, memory problems, difficulty concentrating, a sense of mental slowing that builds gradually and is easy to miss in the early stages. Research has found that long-term benzodiazepine users show measurable changes in cognitive performance compared to people who have never taken them. These effects are subtle at first, a word that takes longer to find, a conversation that requires more effort to follow, a task that used to feel automatic now requiring conscious focus. Over years, they compound. And because they develop so slowly, they are almost never connected to the pill taken every morning. They are attributed to stress, to aging, to everything except the medication that has been part of the daily routine for years. The withdrawal process from Xanax, when managed carefully and with medical supervision, is possible, but it is not simple and it is not fast. The label recommends a gradual taper, reducing the dose slowly and deliberately over time to allow the brain to rebuild its own natural calming capacity. In practice, a medically supervised taper for someone who has been on Xanax for years may take many weeks or several months. The pace depends on how long the person has been on it, what dose they have been taking, and how their nervous system responds to each reduction. Some doctors transition patients to a longer-acting benzodiazepine first, one that is easier to taper gradually because it stays in the system longer and produces less dramatic peaks and valleys. The key principle is slow, consistent, supervised reduction, never sudden, never alone. This is not a medication that should ever be stopped suddenly without medical guidance. That is not a recommendation from a wellness blog. It is the explicit instruction in the FDA label. For anxiety management that does not create the tolerance and dependency cycle, research commonly points to cognitive behavioral therapy, which has strong and consistent evidence behind it for both generalized anxiety and panic disorder. Regular aerobic exercise is widely discussed in the research as one of the most supported non-pharmaceutical approaches to reducing baseline anxiety over sustained periods of time. Magnesium is commonly discussed in the context of supporting the brain's natural calming systems, and many doctors recommend checking magnesium levels in patients experiencing anxiety, since deficiency is common and frequently overlooked. And the questions worth bringing to the next appointment: how long is it medically appropriate for me to continue this medication at this dose? Has my dose changed since I started? And what does that pattern mean for my treatment? Is there a tapering plan in place? And what would a supervised reduction look like for my specific situation? Are there other approaches we should be exploring alongside or instead of this medication? These are not confrontational questions. They are the questions of someone who has read the label and wants to understand their options. A good doctor will not be threatened by them. Subscribe to Med Truths. Every week we open the label on the medications most people take without ever reading what is inside. Here is the truth about Xanax. It was designed to provide short-term relief for acute anxiety and panic. It works faster and more powerfully than almost anything else available for that purpose. For someone in the middle of a panic attack, that speed matters, that power matters. But the brain that experiences that relief begins immediately to adapt to it. Not slowly, not gradually over years. Immediately, from the very first dose. And the longer that adaptation continues, the more completely the brain reorganizes itself around the presence of the pill. Until stopping is not just uncomfortable. Until for some people, Stopping suddenly without medical supervision becomes genuinely dangerous. A pill designed to calm the brain can, over time, leave the brain unable to stay calm without it. That is not buried in a footnote. It is in the boxed warning at the very top of the label, the most prominent warning position the FDA uses. It has always been there. You just needed someone to read it out loud.